is defined by the Oxford Dictionary as an inflammation of the endocardium. We can break down the word endocarditis into its prefixes and suffixes, with endo meaning inside or within, card or cardio meaning of the heart, and itis meaning inflammation, so quite literally, the inflammation of the inner lining of the heart. With a normal heart that has regular flow, both ventricles pump at the same time, and both atria pump at the same time. So you can see in the image in the middle of this cookie here, you can see that the atrioventricular valves are shut and the semilunar valves are open, allowing blood to flow out through the pulmonary artery and the aorta. In the case of endocarditis, there is always turbulent flow. So in the image on the right, we can see here that the heart is pumping blood through the semilunar valves, but the mitral valve is not fully closed, allowing some blood to regurgitate back into the left atrium. Now, what this turbulent flow does is it causes injury to the heart. With that injury, the body performs its regular functions and uses the blood clotting system to close off the wound in order to heal it. But in the case of endocarditis, what ends up happening is the patient will have a foreign agent, in most cases, in the body that will latch itself onto that clot and begin to replicate and form what's called a vegetation. And here on the left side of this slide, you can see an image of an echocardiogram with a mitral valve vegetation, which is a collection of bacteria forming a small colony. And this only further harms the valves of the heart, making it more difficult for the heart to pump blood through the body and to the lungs. In most cases of endocarditis, a bacteria is what causes it. So some of the main perpetrators are virulent streptococci, which is a group of bacteria in the Streptococci genus, Staphylococcus aureus, Staphylococcus epidermidis, Enterococcus faecalis, Streptococcus bovis, Coxiella burnetii, and the Haysick organisms, which includes Haemophilus, Aggregatibacter, Cardiobacterium, Eikenella, and Kingella. In some cases, a fungus can also cause endocarditis to occur. In far rarer cases, genetics can be at play in causing endocarditis. For example, for patients with systemic lupus erythematosus, or commonly known as lupus, it can cause a syndrome known as Liebman-Sachs endocarditis, where most of the inner lining, the endocardium of the heart, becomes inflamed as opposed to almost always on the valves. There are several risk factors that increase the chances of getting endocarditis, including congenital heart disease, rheumatic heart disease, having a heart transplant, having a prosthetic valve, which you can see in the image on the top right, having a pacemaker attached to one's heart, seen to the left of the prosthetic valve, degenerative valve disease, mitral valve prolapse with regurgitation, which is an important distinction because there can be mitral valve prolapse without regurgitation. Chronic IV access can also increase the chances of getting endocarditis, as well as previously having endocarditis. Something that's become a particular issue in the past 60 years has been IV drug use, which you can see modeled by a cookie on the bottom right image. Keep in mind that the next slide may include some photos that might make you queasy, so if you are sensitive to that, please take note. The symptoms of endocarditis can be highly variant from patient to patient, but in most cases you will see fever, and as well in nearly every case you're going to hear a heart murmur, which is something that can be heard by a trained medical professional using a stethoscope, because you can hear the blood flow, the regurgitation past a not fully closed valve when listening to the heartbeat. You generally want to hear a lub-dub, but with endocarditis, you hear a lub-dub and a whoosh, but it's a very quiet whoosh, meaning that training generally is needed to recognize it. It's also important to note that this must be a new heart murmur, not one that the patient has had for quite some time. Additionally, some other symptoms can include having pale skin, muscle or joint pain, nausea or decreased appetite, unintentional weight loss, a full feeling in the upper left part of the abdomen, swollen feet, legs, or abdomen, cough, or shortness of breath. There's also a few symptoms that can be seen quite easily and pointed out, which will now be in the images. Firstly, this includes things called splinter hemorrhages and Janeway lesions, which can be seen in this image here. So splinter hemorrhages and Janeway lesions are caused by parts of the vegetation breaking off and entering into the bloodstream, becoming what's called a septic embolus. Septic referring to the fact that it's bacterial in nature, and embolus meaning that it's a chunk of something floating through the blood. And so they can often lodge under the fingernails, causing splinter hemorrhages, as well as Janeway lesions, which are these small spots that can appear on the palms of the hands and the soles of the feet. If the immune system responds to this, it can cause painful Osler's nodes. And another place where the septic emboli can be deposited is in the eyes, causing Roth spots. Another symptom of this that's not as visible, but still caused by this septic embolus, is glomerular nephritis in the kidneys. Nephritis is almost always caused by a bacterium. A blood culture can be made of the patient's blood to detect the presence of certain bacteria. So you can see here in this image of these cookies a negative blood culture and a positive blood culture. An additional test that can be performed to aid in the diagnosis is an echocardiogram, which is essentially an ultrasound of the heart. As far as treatment is concerned, most of the time it involves antibiotics for bacterial infections, but in cases that are very severe, especially where heart failure is a risk or where there are multiple vegetations that are quite large, surgery can sometimes be the method of treatment. Now, it's important to note that obviously not every cause of endocarditis is bacterial. And so at times, patients suspected to have endocarditis will have a negative blood culture for all of the tests. This could mean that it is fungal, but also some have speculated that a virus could be causing endocarditis. According to a study by Pierre-Edouard Fournier et al., which evaluated 759 patients with blood culture negative endocarditis, they found no cases that for certain had a presence of some viral agent causing the endocarditis. So what can be taken from this study is that as a scientific and medical community, there is very little information on the topic of viral endocarditis, so a definite conclusion is not clear at this point in time. Streptococcus sanguinis is a bacterial species that belongs to the viridans Streptococci group. Viridans comes from a Latin root meaning green because in a test that differentiates Streptococcus pneumoniae from the viridans Streptococci group is a test called the Opticon test, in which the viridans group is resistant and S. pneumoniae is not resistant. And in this Oppican test, viridin streptococci group produce a pigment that is green in color, which can be seen on the top right. S. sanguinis in particular is the most common cause for subacute bacterial endocarditis, with subacute meaning between acute and chronic, which denotes to the amount of time it takes for a disease to progress in severity. S. sanguinis is commonly found in the mouth and is able to modify the environment of the mouth, making it less hospitable to certain species of Streptococcus that can cause cavities. So in many cases, it's a good thing to have in one's body, but if it's able to enter the bloodstream through, for example, an oral surgery, it does have a risk of causing infections within the body. When it comes to endocarditis, S. sanguinis has a fairly low virulence, tends to attack damaged valves and create small vegetations that do not destroy the valves. According to an article by D.W.M. Verhagen et al., viridin streptococci are the causative organisms in 40 to 60% of the cases of community-acquired endocarditis of the native valve. Because the viridin streptococci are relatively avirulent, the cause of endocarditis caused by these microorganisms are slow and metastatic abscesses are rare. S. sanguinis and other viridin streptococci are round in shape, as can be seen in the image on the left, and tend to form chains, as can be seen in the image on the bottom right. Staphylococcus aureus is another species of bacteria that can cause endocarditis. The species name aureus comes from the Latin root for aurum, meaning gold, because the colonies are yellow gold in color, as can be seen on the bottom right. S. aureus is known to be the most common cause for acute endocarditis, meaning that it is highly severe and has then a high virulence. S. aureus is able to attack both damaged and healthy valves, oftentimes the tricuspid valve, and creates large vegetations that destroy the valves. The reason why S. aureus has a high virulence is because it binds to the Fc fragment of immunoglobulin G, leading to uncontrolled enhanced inflammation by the immune system. There has been a significant rise in S. aureus infections, especially due to IV drug use, because S. aureus is a normal part of the skin's microbiota. And so then when proper hygiene is not taken into care, it can find its way into the bloodstream and cause infection within the body. Similarly to S. sanguinis, it is for the most part commensal and will not attack the body, but it can become an opportunistic pathogen. S. aureus is also round in shape, as can be seen in the image on the left, but as opposed to creating strands as it replicates, strands of successive bacteria, they tend to form small clumps, which can be seen on the top right. S. aureus is most often first treated with methicillin, but some groups of S. aureus are resistant to this and are referred to as MRSA, or methicillin-resistant Staphylococcus aureus. Beyond methicillin, they can also be treated with vancomycin unless they are resistant and referred to as VRSA, at which point they would be treated with other antibiotics. Infections with Staphylococcus and Streptococcus can be differentiated through the use of a catalase test.